Urinary incontinence. So it is the involuntary loss of urine from the bladder. It can be caused by a UTI, a loss of sphincter control, or a sudden change of pressure in the abdomen. It may be permanent or temporary. It can be caused by heavy lifting jobs, high impact sports, or long periods of standing. It can also be caused by obesity, chronic lung disease, surgery, and a lack of estrogen. So there are 6 types of incontinence. Stress incontinence is when the patient sneezes, coughs, or does heavy lifting. You have urge incontinence that is associated with conditions such as Parkinson's and Alzheimer's. You have overflow incontinence, which is the inability to fully empty the bladder. You have mixed incontinence, which is a mix of stress and urge incontinence. Functional incontinence, that is the influence of mental and physical impairments where the patient can't make it to the toilet in time. And then you have total incontinence, which is the complete loss of bladder control. So for your clinical manifestations, you're going to see an involuntary loss of urine. For your assessment, you want to determine factors related to episodes of incontinence, review voiding patterns and behaviors, and assess for benign prostatic hypertrophy in men. Your medical management, you can use implant injections to firm up the bladder, neck, or urethra. You can use indwelling catheter, which may be temporary, or you can use the straight cath. You can use what's called the pessary device. You can encourage Kegel exercises. They have a transvaginal tape sling. They have estrogen replacement and medications such as the transdermal oxybutynin, which is oxytrol. So for your nursing interventions, let the patient know that there are some diet modifications and they want to avoid alcohol, caffeine, and spicy food, which may irritate the bladder. You have bladder training exercises such as the Kegel. So for women, they would do 10 reps 5 times a day. You want to establish a 2-hour bathroom routine. So the patient's going to use the restroom every 2 hours. And then most commonly is the incontinence pads or the briefs. So that is your urinary incontinence disorder.